and we can't wish this off. I also would like to mention, and these people, if they are here, they should fall forward for me. Mr. Dennis Kofi, internal auditor, is he here? Fall forward for me. Mr. Joseph Adams, our clinical supervisor and risk manager, please fall forward for me. Mrs. Evelyn Tachi Benson, aka Evelyn Amoako, fall forward for me. Mr. Emmanuel Dogre, is he here? HR manager. Mr. Richard Aholu, head of finance, acting CA, please come forward. Mrs. Susie Efua Kabe, chief pharmacist. Mr. Hifford Asari Williams, deputy hospital administrator. Monsignor Paul Abankwa, financial controller. Mrs. Anita Oseitufo, head of nursing services. Dr. Mighty Alfonso Romero, medical director. Please fall forward for me. I want you to clap for ourselves and these men and women. Thank you so much for all we have done together as a team. God bless you. Thank you. Please resume your seat. I mentioned them not for any other reason, but because specific assignments were given to them, and as the ED of CHAG announced, they didn't have any problem with us. It's all because some people were working and they executed their assigned mandate so beautifully. At this juncture, may I declare my loudest signature phrase on teamwork once more. My dear friends, let us always remember that together as a team, the roads are divided to double the successes. Together as a team, it is just a matter of dividing the roles, but always think about what comes thereof. Successes are doubled. May we forge ahead ever more resolved in a united band. God is not done with us yet. We shall live to tell more success stories to the glory of God. Whilst we celebrate this great success with joy and enthusiasm, I wish to use this occasion officially and humbly request. I'm very happy Nana Kwetiahene eventually made it. Nana, you're most welcome. So officially and humbly, I'm requesting both Osaberima Kofi Boateng III, Akwetiama Hene, Nana Barima Akwesi Ejakwa Ano, the first of Buadia Hene, and our Honorable DC of the Chembo District, for the immediate resolution of the standing impasse between the District Assembly and St. Dominic Hospital. Although I have visited both the chiefs and DC on a separate occasion to tell them about this story. What is this? The District Assembly is demanding an amount of 701,538 cedis 83 pesos, in their own words, being the total cost of certificate of habitation since the Dominic Hospital was built here. I don't understand. When St. Dominic was built, I was not, my parents, I don't think they even had met. And now you were 6 years. Now they ask us to come and pay 701,000 for certificate of habitation. Please. As I explained to you, Nananom and Chief, I'm doing this on the official basis as best as I can. What I have said with you is purely private, but this is official, so I make it so with all the strength I can marshal, and ask you. You see, by the law, we have the lawyers here. This hospital does not declare profit, and every pesewa made after cost is reinvested into the development of the hospital for the general social benefit of the community and the population at large. Indeed, the hospital does not pay taxes to government. The staff, we pay, but the hospital as an entity, we don't. It's by law. Rather, we withhold taxes of suppliers and pay same to the government. We do this every month. Unfortunately, and I say this with sadness, this position falls flat with the district assembly, as they have failed to simply appreciate this. After I personally addressed their General Assembly meeting on 4th November 2021, they still write me letters and summon me. I'm sorry. It is not without respect to you. I don't disrespect you, but as I have said, I'm sorry, I will not come. If it's still on this basis, I'm sorry, I will not. For crying out loud, the success stories we are telling today inures the benefit of Egutiamai and the district, Denchembo district, in general. St. Dominic Hospital serves the population of the Denchembo district and is the district hospital. I mean, how do you shoot yourself in your tire and survive it? It really beats the understanding of the ordinary mind what anyone seeks to achieve by pursuing this line of action. Your Excellencies, the next phase of development of the hospital is the establishment of physician assistant school on the basis of a twin vision of hospital management team, thus to bridge the manpower gap in healthcare delivery inflicted with limited numbers of prescribers, and also to forestall the debilitating effect of prescriber attrition, especially at the district level, as it prevails here at St. Dominic Hospital. Please indulge me to state that it is not because St. Dominic Hospital has money that this project is being carried out. Indeed, there are many occasions that I know of my bishop that he has had to even solicit funds from stakeholders, especially our foreign partners, to make projects a reality since I have assumed office here as the hospital administrator. And the oxygen plant here is a clear example to that, and all many others. So it's not because there is money. I want to tout and say it's because of prudent management. On this point, I wish on behalf of management and staff to sincerely express the heartfelt appreciations of St. Dominic Hospital to all who in diverse ways contributed to the achievement of these great successes. Without mentioning any particular person, but the Executive Director of CHAG, Dr. Peter Yeboah, for the singular led role in this remarkable achievement. Chief, thank you very much. And on this note, I please request you to step forward. Please join me. So St. Dominic Hospital today confers on you as our special friend and partner with the special pin designed and designated to Dr. Peter Yeboah. Thank you, Doctor. Let us clap for Dr. Yeboah. Doctor deserves it. Thank you. We are very grateful. We are very grateful. To you, one and all, we are deeply grateful, and may God bless us all. Thank you very much.
Oh, we can do it for the last time. Okay, so